As we know, chronic kidney disease is a global disease burden. The most severe spectrum of chronic kidney disease is end-stage renal disease, which requires dialysis or kidney transplant. By using a large cohort with more than 500,000 participants, we found that engaging at least 30 minutes per day, 5 days a week, can significantly reduce the risk of dialysis.
Hi everyone, my name is Wayne Gould from Taipei Medical University School of Public Health. And here sitting next to me is my colleague Cai Ming Guang, and he's a PhD candidate at School of Public Health, National Taiwan University. And he is also our first author of a paper recently accepted at Mayo Clinic Proceedings. And here we'd like to share our research finding. The title of the paper is The Role of Physical Activity in Lowering the End-Stage Renal Diseases.
We observed a dose-response relationship between physical activity and risk of dialysis, and the protective benefit is even better when engaging high-intensity physical activities.
So how does this finding relate to clinical practice for medical health professionals?
We believe healthcare professionals should encourage their patients to engage routine physical activity, like 3, 4, 5 times per week. Like more is merrier, especially for those patients with metabolic and cardiovascular risk factors. Physical activity will reduce their risk of chronic kidney disease and dialysis.
Interesting. What about patient? How does this means for patient?
Our findings suggested that if inactive patients with hypertension, diabetes, or CKD started engaging in physical activity, their risk of dialysis would be significantly lower than those who remained physically inactive.
Wow, the benefit of physical activity is amazing. So I believe that a lot of our listeners, they are interested in this line of research. So what do you think is the next step for this line of research?
The next step for this line of research could be the risk of prolonged sitting on chronic kidney disease and dialysis risk, which could be a risk independent of physical inactivity. This line of research can be improved by using objective wearable devices to measure physical activity and prolonged sitting.
This all sounds very interesting. I think these findings are clinically relevant and are very important message for individuals, especially for those individuals with chronic conditions. You know, I cannot wait to do some sports now after listening to you. Shall we do some sports now?
Sure, I agree.
Okay, thank you for your listening. Stay active and stay fit. Okay, bye.
Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.